Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm so excited to have you here today. If you are watching on YouTube or you're listening on Spotify, thank you so much for joining us today to listen to another amazing episode. And I have another amazing physician who is doing great things in the world of DPC, and she's going to tell us all about it. So Dr. Gonzalez, thank you so much for coming in today. I'm excited to have you here. And thank you for volunteering to be a guest on Physicians Keepers.
Of course. Thank you so much for having me. I really appreciate it.
Yes. So Dr. Gonzalez, I'm just going to go straight into her bio so she can. I know she has a lot to share, and I want us to be able to hear everything she has to say today. So Dr. Gonzalez, she is a family medicine DPC physician. She also runs a CRM company that helps physicians escape the fee-for-service system and open their own DPC practices using systems and automations to stay organized and to grow their practice. So you are quite a busy physician, and you also run a podcast. So just kind of tell us, for someone who just heard what I said and just I was like, okay, they had CRM, they had DPC, and they're like kind of wondering
Yeah, alphabet
is
soup.
what are they talking about? What does she do? Can you just and I would just kind of just start, just kind of building with you, but um we're going to get into Joseph, don't be confused. We're going to get into the whole definition of DPC and how that works. So it's a deviation, so to say, right now from the traditional practice of medicine. And those of you that are familiar with that, this is, insurance-based practices. But at what point did you realize that the traditional system was not working for you and made you decide to branch out into DPC?
hmm Yes. So, kind of like a lot of other physicians, it
Yeah.
was around 2020. Good times around
Yeah.
COVID.
Yeah.
So, I had been at my previous practice for about 13 years, and it was me and I was in a multi-specialty practice. So, primary care with OB and GYN.
Yeah.
And the and so it was a large multi-specialty practice. I had three mid-levels under me.
Yeah.
And with mid-levels, and when I say mid-level, I mean PAs and nurse practitioners, it's really much easier for them to leave a job and go into
It
something else.
is.
It's 2 weeks notice and you're gone. And and because of that, we had a lot of turnover with our mid levels. So it was like a revolving door. There was always someone coming in every 1 or 2 years, but I was the only constant, which
Yeah.
is good. And patients would come to me and they'd say, "Oh, are you ever leaving? Everyone else is leaving." And I was like, "No, unless some kind of catastrophe happens." And when I say catastrophe, I'm thinking earthquake or,
Yeah.
like something like
Yeah.
that. But then it was COVID. And by that time, there was another physician who had come and joined the practice as well. That's my current partner. And she's an internal medicine doctor. And,
Yeah.
going through an experience like COVID together, you just get to be really, really close. So not only were
Yeah.
we coworkers, but became very good friends. And we got on the topic of DPC, which is direct primary care.
Yeah.
And so I'll just stop and explain. Direct primary care is a different model of providing care. So, fee for service or insurance based medicine is when you have your insurance and you use your insurance to pay for your care. But direct primary care is membership model, it's membership medicine. So, it's a membership fee per month. And you have your primary care needs covered. We do same day or next day visits. We have, we basically do everything that a regular primary care office does. It's just you don't have to pay copays. There's no surprise bills, 2 or 3 months later after your insurance has paid, and then whatever is left over is your responsibility.
Yeah.
And so we contract directly with the patient. So there's no middleman because there's no insurance involved. We don't
Yeah.
need multiple people, bringing our patients back, answering the phones, filling out insurance forms, all of that
Yeah.
that's involved with fee for service medicine. So it's a very simple model. It's whatever the monthly fee is, and then that's it. And we also provide low cost laboratory testing and also almost at cost generic medicines. So for people who have insurance, it's still a good deal because if you have
Yeah.
high deductible insurance, your deductible, if you're healthy, you're never going to meet that.
Yeah.
And then for people who don't have insurance, it's really good too. So anyway, so backing up, so direct primary care, I'd heard about it probably about 15 years ago at this point, and my children were small at the time, and I thought this sounds really amazing. I could never do it because my
Yeah.
husband's a physician. He's a partner at his practice. My children had 3 children. They were all very young. I can't, I couldn't
Yeah.
do this. And so my partner, Rachel, and I were just talking, and somehow we got on the topic, and she had also considered it too, but same thing. Her husband's a physician. She also had small children, and she thought there's no way I could do this by myself. And we were almost kind of laughing, like, oh, ha ha ha, ha. Wouldn't it be funny if we did that kind of as a joke? But then we
Yeah.
stopped after a second. We are like, you know what? We really could. And after COVID, know, everyone was so disillusioned with
Yeah.
medicine as far as physicians and healthcare providers. We felt like, are we really helping patients? What are we
Yeah.
what are we doing? Are we
Yeah.
making changes in their lives? And so at that point, we thought, I think that we need to do this. We need, because we knew that for one thing, it's a better model of care. It's
Yeah.
good for the patients, it's good for the physician. But then also, our practice was changing. The woman who had started the practice had retired, and she really was the champion for primary care. And we just, like the writing was on the wall. We knew it was happening. The visits were going to get shorter. We were going to have to see more patients. And
Yeah.
already we didn't feel like we were doing a great job. So we just knew it wasn't going to get any better. So
Yeah.
we decided to leave and open up our practice. And we were very different than most people who end up transitioning from fee for
Yeah.
service into direct primary care because we were the only primary care physicians in the practice. The other physicians, OB-GYNs, they could not supervise the mid-levels, and so they decided to completely shut down the primary care division. So we were really lucky in that we were able to take our patients, or a lot of our patients
Yeah.
decided to come with us. A lot of patients, or excuse me, a lot of physicians who transition, they don't have that luxury.
That's
So
right. No, they don't.
yeah, yeah. So we were quite lucky in that they were like, please take your patients with you because we don't know what to do with them. But yes, so that's how we got into it. And that was in we gave our notice in May of 2021 and we opened in September of 2021.
Oh, wow. Oh, wow.
Yeah.
Now, as with everything that's new, right? It takes courage, one, because this is something that you all, I mean, even though you're taught about it and it looked like a better model, but I mean, it was new to you, right? So there were certain fears that you had to overcome. Um, I mean, like I said, it sounded great, but then there were certain fears you had to overcome to step into this new venture. What were
Mhm.
those fears like for you?
Yeah. Number one, is anyone going to join? Is anyone going to follow us? Because it's a different model.
Yeah,
There was one other practice in our area that did direct primary care, and that was it. And
yeah.
so it's a completely new model. We had to do a lot of education about what is direct primary care. And 5 years later, we're still doing education about what is it? But it's getting better. People are learning about it. But it is outside of regular insurance. And
Yeah,
people in America are so married to their insurance and are sorry to say, but brainwashed to thinking that insurance is the end all be all for their
yeah,
health care when it is not.
yeah,
And there are so many stories now of where insurance, yes, you need it. don't get me wrong, insurance, we recommend our patients have insurance, at least catastrophic, for those
Yeah.
unexpected expenses like accidents, severe illnesses when you have to go to the hospital. But for primary care in general is very inexpensive compared to
Yeah.
things like hospitalizations. So when we can do things like the labs for, say, an annual lab panel, a blood count, checking your liver, your kidney functions, your thyroid, cholesterol. If you get that done through your insurance, it can cost up to $250. And
Yeah.
if you have a high deductible and you haven't met your deductible, you're
You're
paying
paying for it. Yeah.
$250.
Yeah.
But if we do it through our what we call client bill labs, that's $25.
Wow. Yeah.
It's really primary care really isn't that expensive. It's insurance that has kind of blown it up.
Yeah. Yeah.
Yeah. And
Oh, wow.
yeah, yeah. And I mean, I understand, like, now I really understand the game per
Yeah.
se.
Yeah.
When I was in fee for service medicine, truly, I didn't understand insurance. I didn't understand how things worked. And patients would come and say, "Did you know that vitamin D cost me $250?" And I was like, "What? Really? I didn't know it
I
was
didn't know
that
that. Yeah.
expensive."
Yeah.
And yeah, it was. It was, but
Yeah.
now it's 16. So it's very eye-opening once you start
Yeah.
learning about how you can, get your health care without insurance.
Wow, that's that. Like I said, it sounds like also with you, one of the things that was very helpful for you was you found someone else that was kind of like in the same mindset and was
Mhm.
willing to jump on this adventure, so to say, this
Right.
new, because doing it on your own is scary, but I guess having someone that was committed as you were, and also willing to share the same responsibility burden with you,
Hmm.
that must
Hmm.
have also been very great.
Yes, yes. And just like I said, we thought when we had heard about it individually, there was
Yeah,
no way we would even consider it. But yes, and we're very lucky to have each other because most
yeah,
people, when they do this, are not. It's very rare to have somebody opening a DPC with a
it
partner.
is. It
Yes.
is. It really is. Now,
Mhm.
how has, going into DPC, how has that changed medicine for you in the sense that with your patients, like from traditional medicine, what change should that bring about in practicing medicine for you?
Yes. I actually now can practice medicine the way I was trained,
Yeah,
with doing many more procedures, doing a whole lot of patient education. I can research topics so much better now when you just didn't have time in
yeah,
regular fee-for-service medicine. So a lot of times in that regular insurance-based system, you get referred out. Patients will get referred out a lot for things that I know how to do. It's
yeah,
just there was no time. So, doing a shave biopsy, taking off a mole, lancing an abscess. I mean, we do our own EKGs now. We can, we do injections. Like I didn't
yeah,
used to do injections just because it was taking too much time, but now we can do that. People can come in for their physical, and
yeah.
in the fee for service system, your physical is a whole different thing than what most people think it is, right? They think
Mhm.
a physical means we get to talk about everything that's happened to me in the past year. And it really should be. It should be, but it's not.
There's a battle. It's every day.
Yes.
It's an
Yeah.
everyday fight. If you're in the traditional system, it's an everyday fight with patients where it's like
Hmm.
they come in like, what are you here for today? It's like my physical. And then you
Hmm.
start to have the conversation and like you're kind of straying away from what the typical like, if you bring up this conversation,
Hmm.
this is it's not a physical anymore.
Yeah. Yeah.
Like
And
if
then
you
we
want
have
me
to
to
bill you for it.
yes, if like and it's like, well, I didn't pay a copay. Well, it's gonna have to come up if we discuss this.
Hmm.
So
And I hated that.
there's a lot of education, and like I said, that's something that in primary care I have conversations about every single week. It
Hmm.
feels like almost every day when you have to like tell patients, this is what your insurance allows. in a physical. It's not, I don't make the rules,
Mhm.
but if I talk about this, I can't say I didn't talk about it. If I address this, I have to put it in the chart, and then it's technically, I mean, we can do physical and something else, but it's not a free visit as you
Mhm.
would supposedly think. So yes,
Right.
those conversations are had every single day with
Yeah.
with a lot of patients.
It is exhausting.
It is. It absolutely is. Now,
Yes.
in your so now you have a podcast, and
Yes.
your podcast says that your practice should fit your life and not the other way around. So, in your experience with DPC, has that helped you to kind of navigate what you want your life as a practicing physician to be?
Sure, absolutely. It really has. And because of being able to talk to different DPC doctors, I love hearing how people do things in their practices. There's a saying that once you've seen one DPC, you've seen one DPC because everyone's is so different.
Yeah.
So I've learned so many different things about how people do things in their practices that I'm like, oh, I'm going to steal that idea. But yes, it's been a lot of fun um, having this experience. And I say that DPC, for anyone who goes into DPC, is truly life expanding because you get to do so many things that you never would have gotten to do before. So for not just the medicine, I mean, like I said, we're doing all these different things like procedures and injections and skin things, and we are actually doing aesthetics in our practice now. I never ever would have thought I was going to be doing that.
Wow.
So in that sense, it's life expanding, but then life expanding in that we get to meet so many different people that you never think you would get to meet. Like I never would have met you otherwise, right? And
Absolutely.
and so doing so many different things, going so many different places, doing so many different things outside of the practice. So even though it's a weird uh it's a weird difference. It's busy. It's a different kind of busy. It's a
Yeah.
different kind of hard.
Yeah.
Yeah, but so I totally think it's so worth it for, the differences. Um Totally life expanding.
That's amazing. I mean, because even I mean, you work for a health system before, and now you are stepping into the world of entrepreneurship, right?
Hmm.
Where
Hmm.
you are making the big decisions, right? I mean, I said you didn't go into the traditional system, so then you're kind of setting the rules-ish to a certain degree. What mindset shift did you have to encounter to actually think of yourself as an entrepreneur? Because I mean, every physician is familiar that we're not taught business, right? Sometimes
Hmm.
when you're
Hmm.
talking business, it sounds very strange to a lot of physicians. And when you're in a traditional system, a lot of times it's easy to just allow the business side of the conversation to be dealt with the practice manager, with the
Hmm.
administrative folks. And like, okay, I just want to see patients. Like that's what I want to
Hmm.
do.
Hmm.
Anything else, you'll figure it out. But now you are in that setting where you are the one making decisions.
Hmm. Hmm.
Entrepreneurship, was it just a easy breezy thing for you to step into? Did you feel like I got this? Did you need to have some form of business coaching, or like how did you work your mindset to where you are right now?
Yeah, so as far as entrepreneurship and business, I'd never taken any business courses, never done any kind of business coaching previously. But once I started learning about it, this is one of those life expanding things. I didn't realize I enjoyed it. I enjoyed learning about it. Um, I enjoyed talking about it.
Yeah,
So I read so many books and listened to so many podcasts, and I guess this is just as a lifelong learner, this is just a
yeah,
new thing, right? That
yeah,
that I like to learn about. So it's been fun for me. And actually, having a partner has been really good because there is so much that goes into running a
yeah,
business, right? And so the good thing is that we are really good partners together because there are things that she's really good at doing, like managing a lot of the kind of financial stuff. And then I'm better at more of the marketing and the networking and things like that. And she hates that. And not that I hate doing the money part, it's just not my forte. So
Yeah.
it worked out really well. So if there's anyone who's thinking about doing a partnership, try to find somebody that has strengths and things that you don't know about or you're just not
Yeah.
as strong in.
Yeah. Yeah. I mean, that, like I said, your partnership, I would say, like I said, that was a huge blessing for you to be able to go into this and navigate it with somebody else. So,
Mhm.
you said you were pretty fortunate. Was there any book in particular that stood out for you, like, or any coaching, like whatever, something you listened to that stood out for you? They were like, yes, this person gets it.
Mhm.
Like they've,
Yes.
so can you share that with us?
Yes. Sure. And I think um I don't know if this is where we kind of connected, but the EntreMD podcast and Dr. Una and all of her books, I'm a complete fangirl.
Yeah. I'm a Dr. Una fangirl too. So. Yeah, but I think
So
we connected in another position and well, no, that was it.
was it?
Yeah.
I couldn't
That
remember.
yes, that absolutely was it. So awesome. Awesome. Yes, Dr. Una is doing amazing things in the
Yes.
world of medicine, with the mindset shifts and all that. So
Hmm.
awesome. Now,
Yes.
did you join the school?
That's on my bucket list kind of thing. That's on my list of things to do.
Just
So
there are a lot of us who have put it down on our bucket list, so don't worry. I'm there with
yeah.
you.
Yeah, I know. Actually, this year I was thinking, okay, maybe the private practice, um, uh, what is the,
PPM.
yeah, yeah,
Yeah.
yes, that one. That
Yes.
one. I thought maybe
Yes.
that
Private
one,
practice movement.
and then maybe the full-on business school. But I know several people have done the business school for years, and I'm thinking
Yeah.
that's great, and they've done
Oh,
wonderfully.
they have. But I said, I mean, like I said, even just the fact that you're able to get so much value from the free stuff, right? Just even the podcast alone,
Hmm.
and then she has all this mini sessions that she does.
Hmm.
There are a lot of value to even be gotten
Absolutely.
from that. So, anyone, if you're listening and you're a physician, that's a really great resource. There are a lot of physicians who have connected on that platform, right, where you have that mindset shift of I can actually, she talks about the entrepreneur part of you, right? Not so much
Hmm.
as
Hmm.
where you are your own brand. And I said, this can fit into anywhere. It doesn't necessarily have to be
Hmm.
DPC. You can be your own brand
Yep.
in traditional medicine. You can be your own brand as a MD anywhere else.
Right.
So,
Yes.
yeah, so we're complete fangirls here.
Yes, yes, I know. So Dr. Rachel Rubin is
Yeah.
one of her, school students,
Yes,
and
students.
oh my
Yes.
gosh, she's like a star.
Absolutely. It's like it's kind of like connects to like, right? When
Hmm.
sometimes if you're not in the sphere or in the room, you're out there thinking, what else is there? But when you go into a room and you see all these physicians who are shining, who are doing amazing things, it just
Hmm.
leads, okay, this is actually possible,
Yep.
right? And so that's also one of the things I encourage physicians, right, to do when you want to do something new, when you want to do something that you feel it's maybe out there that's not in the lane, so to say, for traditional medicine or like a
Hmm.
physician, try not to do it alone, right? There
Right.
are spaces, there are rooms that you can insert yourself in, and then you would see that there are other physicians who are doing it awesomely, like doing amazing things. And
Hmm.
that elevates your mindset to say, okay, this is actually possible. And so even with, with what you're doing with your podcast and creating that DPC connection, right? So physicians who were kind of on the fence, struggling, thinking, is this right for me? Being
Hmm.
in
Hmm.
those rooms, hearing those conversations, um, reinforces or realigns whatever it is that they were feeling on the inside. And then also, learning from y'all's mistakes, because I'm
Right.
sure along the way you have made some mistakes and you're like, okay, maybe we should not have done that. Maybe
Lots of
that was
those.
not a good decision. Would you mind sharing some of those that kind of stick out to you as like, oh, maybe that was a bad decision? And,
Hmm.
would you mind sharing those with us?
Sure. I mentioned that we do aesthetics in our practice,
Mhm.
and we'd done aesthetics for probably a year when we purchased our first energy device. That
Mhm.
one, I think, still that was a good purchase. You know, we may have could have waited a little bit longer before getting it, but then about a year after that, we purchased a different one, a laser, a completely different laser. And that was not a good purchase. And that was a very expensive mistake.
Oh wow. What
Yes,
what
but
what made it why was it a mistake? Was it something you were not ready for yet? Like the volume? Um,
yes,
okay.
it did have to do with volume, and it's something that we did not understand really at the time. It was still just my partner and I kind of doing the aesthetics and doing the treatments. And when we purchased the machine, we didn't realize that, you know, a laser really is a high volume machine. Like you need
Mm.
to run that machine, you know, 5 days a week, 8 hours a day
Oh
in
wow.
order to make the money back. And
Yeah.
so we ended up having to hire an esthetician, which still was a good thing.
Yeah. Yeah.
But you know, it took us a while to kind of figure that out. And you know, that those machines, obviously not cheap. You have to pay off your balance every
Yeah.
month. And it was in retrospect, of course, you're like, okay, yeah, that was probably not a good thing to do.
It's a learning moment, right? There are
And
no mistakes, they're all
this,
learning
yeah,
moments.
I know. And the sad thing is, though, a lot of people make that mistake too. And so, yeah, if there's any DPC doctors who are thinking about doing aesthetics and purchasing a laser, please think about it long and hard before you do.
Well, thank you
Not
so much.
saying lasers are bad. It's
Yeah.
just you need to be prepared for what you have to do in
You
order
need
to
to weigh the financial
pay it off.
costs.
Mhm.
Yes.
Yeah.
Now, what are some of the biggest myths that you've heard concerning about DPC?
So, myths as far as DPC is people think that because there are some people in DPC who they do it all. Like they are solo, they draw the blood, they, you know, see the patients, they answer the phone, they return the call. Like they're completely micro practice.
Mm.
And if they're doing it well and they are enjoying it, fantastic. But I think for most of us,
Yeah.
you know, it's really hard to do alone. And like I said, I'm very lucky to have a partner, but we do have
Yeah.
people helping us and working for us. We have a VA. When we got
Yeah.
her, it was like a huge weight was lifted off our shoulders because she was answering the phone and doing the prior authorizations and taking some of the phone calls away from us. It was massive. It was a huge difference. And, you know, after we hired her, we thought, you know, that that was one of the good things that we did is hiring a VA. And she's the sweetest person. And she's been with us for 4 years, and our patients absolutely adore her. She's in the Philippines. And our patients, some of them don't even realize she's in the Philippines. They even give her Christmas gifts. They're so sweet.
Oh, wow. So she's all the way in the Philippines. That's
Hmm.
amazing.
Hmm.
Okay.
Yeah.
Okay.
Yeah.
So, I mean, to definitely, except just with your, I mean, because you help other physicians now, build the practice. And we did in the intro talk about the CRM.
Hmm.
What is that about?
So CRM stands for Customer Relationship Manager.
Yeah.
And you probably heard of things like HubSpot, Go High Level. They are platforms that help people with organizing the potential patients or their leads. And these are for any kind of business, right? But I adapted it's a go high level platform, and so I adapted it for direct primary care, trying to put the pieces together that I feel
Yeah.
like would be most useful to help people, especially if they're solo or very small practices.
Yeah.
And so things like help with AI assistance with answering the phone, a chat widget, sending email sequences and text message reminders about meet and greets and scheduling. So it does a lot of different things and takes a lot of things off the physician's plate,
Yeah.
especially if they are solo. So it is not, it's not an EMR. That's completely different. But it does help things stay organized. And so when it's
Yeah.
just you and you're solo and it's all kind of stuck in your head and you've got little pieces of paper here and there, things will fall through the cracks. And so the idea is to try and stay organized and things that can be automated. So things that you do over and over, like, do you take my insurance?
Yeah. Yeah.
Answering that question,
Yeah.
those kinds of things, trying to take that off your plate, especially if you're, like I said, solo and you can't hire someone yet, or you just don't want to hire someone yet. Some of these things can be automated and don't need a person.
Yeah. 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 So basically you're helping other physicians set this up so that they can run their DPC practices, just kind of the things that don't need to be a burden or can be outsourced.
Hmm.
Just
Hmm.
that is amazing. Now, what has been the thing that has like surprised you the most? Like when physicians come to you to say, "Hey, I need help. I see you're doing this amazing things." Like, what has been the thing that has surprised you, either in helping them out or in trying to figure things out? It's like, okay, maybe they didn't know this, or what was the one thing that like, oh, this came as a surprise to me in helping you figure this out.
Hmm. Well, so one thing that a lot of physicians have trouble with, and particularly around my age, so I was born in the 70s. Social media is not the easy, it didn't come naturally.
No, it didn't. It didn't. I was born in the 80s and social media is still, yeah,
Yeah,
it's still a thing. We were
yeah,
not born in front of the camera. Uh,
exactly.
yeah,
Yes. So that's been one thing that, has been a lot of fun talking about with other physicians, is kind of showing them that even though social media can be scary, you don't have to have a lot of tech knowledge, and you don't have to be, putting your whole life on camera. Of course, you can still be in front of the camera, still be an introverted person, but do it in a way that doesn't challenge, your whole value system.
I totally feel you on that. It's one of those things where I'm like, please don't make me dance on TikTok. I don't know that. I mean, I'm not saying, I mean, I really admire physicians who can do that, and it's part of their personality
I
and just the
know.
way they
Yeah.
reach out, but I'm not there yet. Like, I don't know that I'll
Hmm.
ever be there. And yeah, it's a
Hmm.
whole different mindset when that's not you.
Yes. Right. Yeah, it's totally not me. And I see people who it is, and like you said, I'm like, oh, they look so awesome, and
They
more
do.
power to them. And I love watching, I love watching their videos.
Yeah.
And I think, but if I were to do that, it's not authentic, right?
No.
It's
No.
not
Yeah.
me. So
Yeah.
that's the thing, is you have to be, your authentic self.
Yeah. And it's your people will find you. And that's the honest
Hmm.
truth is just being you and not trying to be anyone else, in this whole vast world of social media. Um, yeah, your people will absolutely find you.
Hmm.
Now, looking back, what would you say that DPC has taught you that you would have never learned if you had stayed where you were before? Like, what lessons has it taught you right now?
Hmm. Yes. I think DBC has taught me that I am capable of doing so much more than just medicine,
Yeah, yeah,
because that's been, that was my whole personality, that was my whole life for 20 something years, and I never thought that I would do anything else
yeah,
besides medicine. And not that I'm not doing medicine, but I've branched out and I'm doing so many different things, which, uh, you know it's a good thing, because there's so many physicians who are getting burned out, right? And same thing, they never thought they would do anything but ER medicine,
yeah,
hospital medicine, family medicine. And but DPC is one of those things that will help, I think, extend people's careers,
yeah,
because I think that there's, for example, like an ER doctor, kind of like football players have a certain number of years that they can play. Just their
yeah,
bodies can't take it
yeah,
anymore, right?
yeah,
I think there's a limit on how long an ER physician or a hospitalist or family medicine or internal medicine can practice in the system the way it is now. There's just no way to continue that sustainably,
yeah,
right?
yeah.
For 30 years. I just don't see how that's I mean, there's some people who do it,
Yeah,
but
yeah. But yeah,
um,
the body keeps score.
right, exactly. Yes. So whether it's physically or mentally, something's going to give.
Yeah,
So I think DPC, because of the way where you have time with your patients, you're not rushed, you're in control of your schedule. You're in control of how your business, you're in control. You get to have the patients that you want. If there's patients that are just terrible to you, you know, at previous practice, you might not have been able to dismiss those patients,
yeah, yeah. There's a whole
So,
process to that. Yeah,
mm-hmm, mm-hmm. Yeah, so it's definitely something that I think it will help protect your time, family time, personal time, your mental health, doing something like DPC.
yeah,
And even if it's not pure DPC, but hybrid practice or even just independent practice, not
yeah,
working for a hospital.
yeah. I mean, get like kind of our, I would say, mutual platform. It says get to practice medicine on your own terms, right?
Yes.
That's kind of the dream, the dream
Mm-hmm.
life with this. Now, if someone is a physician who's hearing you right now, it's like, okay, kind of on the fence, like, is this right for me? Like, how do I know? Is there a way they can reach out to you, connect to you, ask questions, like just kind of explore?
Mm-hmm.
How can they get
Absolutely.
in touch with you?
Sure. Well, there's always the podcast, and the podcast is free. I come out with a different episode every week. And so I talk with DPC doctors that are established, and then I also do coaching calls with doctors who are either thinking about or just starting their practices. And that's been a lot of fun. Uh, and then I also have, there's a DPC Life. The name of the podcast is DPC Life. And so there's a community as well. And so we do monthly kind of community support calls. We just
Yeah,
started that this summer, and that's been
awesome.
also really fun. We've had a couple of calls so far, and some of the people have returned, and some are new. And it's great because we talk about things that are kind of blockers or, bottlenecks for them,
Yeah.
and then also work on some goals for the next month. What kind of small steps can you take so that next month, we'll report back in. So it's a little bit of accountability as well. And then I'm on Instagram, DPC Life, and then Facebook, DPC Life, and on YouTube, the DPC Life podcast, I think. But
I
if you
would
just
make sure to
just
share all those
Google it,
links.
it's there.
If you send me the links, I'll make sure I'll plug all of those links in there, so that folks can connect with you. And one of the things I always encourage physicians is on this journey, you are not by yourself. Whatever you want to do, someone else has done it, is doing an amazing job with it. Don't venture in solo, right? Connect to a community, plug in. Um, there's something about being in a room with people who know more than you, right? Walk with the wise is a common saying, and you be wise, So definitely, if DPC is something that you've navigated that orbit and you're thinking, okay, now I want to dive in, I would just absolutely encourage you get plugged in, get connected. Folks like Dr. Gonzalez are doing an amazing job, kind
Thank
of
you.
breaking the myths and just kind of showing you what happens, behind the scenes. So this would be an awesome resource for you. But Dr. Gonzalez, thank you so much. You have been such an amazing physician's keeper today, coming in today
Thank
to
you for
share your
having me.
story.
I appreciate it.
Yes, telling us just, kind of demystifying DPC for us and just showing, physicians what is possible, right, on
Mhm.
that side. And that's the mindset shift. So we are grateful. You've been an amazing physician's keeper today.
Oh, thank you so much for having me. I appreciate it.
Yeah, and so if you're listening to us and you want to share a story, any story, this is Physicians Keepers. This is what we do. We share stories to encourage other physicians, to support them in any stage of their journey. Anything you've learned that will be helpful to another physician. This is just reach out to me, drremola@gmail.com, and we will be so glad to hear your stories. If this episode was helpful for you, beneficial, like, share, subscribe. Share with someone else who you've heard talk about maybe DPC is the right for them, and you'll be shocked that just by hearing, we grow, we experience each other through our stories, right? And so someone just might be in the same boat. And this episode may just be what they needed, that catalyst that they needed, that spark to take their journey to a different level.
Yes, absolutely.
Oh, thank you. Now, before we go, I wrote a book, and so this is me promoting, go ahead to promote my book. It's a kid's book.
Yes.
It's called Captain Cardio and the Heart Ranch. It's out on Amazon now. So if you have a kid ages of 6 to 10, this is such an amazing book for them. It is the first in the series Vaudeville League of Superheroes. So what we do with these books, we just teach kids about the heart, but using a fun and friendly superhero way. So Captain Cardio is the main guy here. He's our hero, and he has an adventure with Placky, and it just kind of just talks to kids about how to protect the heart, how blood flows, and as primary care, one of the things that we encounter a lot is we see adults who did not do a good job on time with taking care of themselves, and sometimes you're left with having to patch things up. And one of the biggest things with primary care is preventative medicine, right? And what better way to teach kids, even some adults, about prevention by just explaining the heart in a way that's fun and enjoyable. So the links, I will put the links in the show note, but it's available now on Amazon. So grab yourself a copy.
That's awesome.
Well, thank
Congratulations. I love
Well,
that.
well, thank you so much. Like I said, this was a project inspired by my daughter. She had homework to do, and everything just kind of came out from that. So I'm really excited about that. Lieutenant Lung is coming up next,
Oh,
and
cool.
hopefully, hopefully by the end of the year, we'll have Lieutenant Lung as the volume 2 when it comes to vaudeville. But Dr. Gonzalez, thank you so much. It's been amazing having you here today.
Thank
I wish
you.
you all the best in your
Thank
journey
you
and
so
can't wait
much.
to
You too.
see and hear all the amazing things you're doing. And I'm sure at some point in time we'll connect on the EntreMD
Yes.
world. Who knows? We may even get to go to the school
And
together. Who
then in
knows?
school, yes, that'd be amazing. I really hope so.
Yes, you have a wonderful rest of your weekend.
Thank you. You too.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.